All right, I think I'm live here, and I'm really, I'll be honest with you, I'm not the best Facebook user, so I get a little bit confused at times. I think we're up and running, and if anybody's out there, just drop a comment so I know and I can see that you're out there. I think it probably takes a few minutes for people to come online. And I think I'll start just by kind of talking about what my goals are and what I've been spending a lot of time working on. I wrote my book in 2013, and it was kind of a one and done scenario where I wrote it once. It was something I thought that had to be out there for the bariatric community, and I got it, a lot of people read it, and it became an integral part of my practice. But what I've been doing over the last 5 years is really figuring out how to integrate a whole foods approach into bariatric eating. And I think that's something that the bariatric community has been really slow to do. And we have continued to focus on kind of protein shakes and low carb diets, and we don't have a lot of science or evidence behind it. And when you do look at how nutrition can impact your health, then you do recognize that there's a huge amount of fruits and vegetables, of data that supports fruits and vegetables in terms of improving your health and driving weight loss. And I found that for bariatric patients, and when we recognize the hormonal shifts that are happening after surgery, that we can look at this way of eating, and it really makes a ton of sense. First and foremost, it's very comfortable. And secondly, it's healthy, and I think it's the best way for bariatric patients to maintain their weight loss after surgery. We've got a couple of questions. All right, so hello from Stacy Sheffer and Karen and Patty. Hello to you. And I've got a question from Hawaii. Aloha from Hawaii. Thank goodness for your book. It's helped me so much. God bless you. Well, I'm glad that it helped you. And I've actually, over the last 4 or 5 years, what I've really been doing is spending a tremendous amount of time with my patients and just kind of refining and taking this first thought I had, which is about how to follow the pound of cured diet. I'll be honest with you, my approach to nutrition hasn't changed one bit in 5 years. Really, I think the only thing that I really do in my practice is I allow unlimited nuts, where if you read the book, I talk about 1 or 2 ounces of nuts. And that's pretty much the only change I've made through my research and through integrating this into my practice. But what I found is that as I've kind of followed people out, not just for the first year or so after surgery, but 4, 5, 10 years out, that there really is a very defined recovery process from these surgeries. And what I've identified is that there's essentially 4 things or 4 stages of recovery after weight loss surgery. And most weight loss surgery patients experience all 4 of these. So the first stage is recovery. And that's that first month, and there's a tremendous amount of anxiety and adjustment that happens during that first month, where you are looking and trying to find how to eat again and what foods you should eat. And that's where we kind of start you off on yogurt and applesauce and move on to more progressive or thicker foods. And it really is just about recovering from surgery and kind of figuring out how to nourish you. It's almost a survival mode. And while there's a tremendous amount of anxiety around that, understandably, because your body is completely changed during that month and you're figuring out how it's going to work again, it really, in my mind, isn't a critical stage of surgery. Everybody kind of gets through it. They get to the other side of it. They're okay after that month, and they kind of start to go on with their life. It's the next 3 phases, or the next 3 things that surgical patients face that are really challenging. And the first year or 2, and it can sometimes drag out to 3 or 4 years, especially in gastric bypass patients, is what I call the honeymoon period. And what the honeymoon period is it's this moment where you have amazing control over your appetite. You can go hours and hours and then have a few bites of food, and it's all you need. And you really just desire healthy foods. You don't desire the processed foods that have kind of driven your cravings and hunger over the years past. And every time you get on the scale, you see a better number, and you all of a sudden are excited to get on the scale. You have energy, you're feeling good, you're feeling healthy, you're coming off medications. It really is an amazing time in any post-bariatric surgery patient's life. But because no one's goal weight is 0 pounds, at some point the weight loss must stop. And when we look at this idea of the surgery lowering your set point, we have to recognize that when your body weight reaches that set point weight, things change. And that's absolutely what they do. And that happens around 1 to 3 years out from surgery. And it's not something where you just wake up and all of a sudden, boom, you're back to your normal appetite. It's something that happens gradually over months to years, but it happens in every single patient. And the number of comments and questions I get about, did I stretch things out, or can't you just make it back the way it used to be, is really astronomical. I mean, that is just so far and away the dominant question is, why are things not like they used to be? And it's because your hormones have shifted, because your body weight and your set point are now the same. And this really marks the transition to the most challenging but also most important phase of recovery, which is the end of the honeymoon, which is how do you adjust to life when every time you get on the scale, you're not losing weight, and hunger and appetite are starting to be a little bit of a battle again, and you're finding yourself attracted to processed foods where it was so easy to say goodbye to those at first. And that whole process really, I think, starts in the honeymoon phase. Recognizing when you start a marriage, you go on the honeymoon, it's great, it's a wonderful trip, but we all know that the entire marriage is not going to be a honeymoon. And I think with weight loss surgery, we have to take that same attitude that, yes, that first year or two is amazing, but we have to use that first year or two to set us up for a better transition once your body weight starts to get back to normal. So let's see what if we've got some comments. Hello, doctor. Hi, doc. Got a lot of high fives out there. I think that's what this is. So once you have kind of entered the end of the honeymoon phase, so what do you do? Is all hope lost? Are you bound and determined to gain back weight? And the answer is obviously no. And it also does depend how that end of the honeymoon period, it differs between a sleeve and a gastric bypass. And I think this is the real advantage of a gastric bypass surgery, is that it provides more assistance in that end of the honeymoon period. I think that it anchors that set point at that new lower weight. And I think the final phase, that really every bariatric surgery patient will battle with a little bit, not every, but I'd say the vast majority, is weight regain. Most patients before surgery were gaining 5, 10, or sometimes even more pounds per year. And then they have the surgery, they drop their weight back down, and they have a period of, sometimes up to 5 years where the weight's stable, but oftentimes you can get back on that 5, 10 pound a year track. And we have to recognize that had you not had the surgery, you'd be even higher than you were when you had the surgery. But nobody wants to be regaining those 5 or 10 pounds. And there's some things that you can do, or that most people I think can do, to prevent that. But it really takes a very systematic and logical approach to this, rather than a kind of emotional and fearful approach, which is what most people come to. That's something I'm trying to outline all of this information, put it together in a neatly structured package so people can understand what's happening to their body and what's going to happen to their life. Probably the single most important thing in my mind about bariatric surgery is proper informed consent. We are making a major change to your body. And it's the most important thing in my mind is for you to understand exactly what that means. Not just the day of surgery, not just the short-term risks over the first few weeks afterward, but really how this is going to impact the rest of your life, because it's amazing surgery if you use it correctly and understand how it works and what these phases of recovery are. But if you have unrealistic expectations, or you don't fully understand what's happening and kind of look at this as the wheels falling off the bus, and all hope is lost and you're bound to regain your weight, then the emotional damage that can be done from regaining a significant amount of weight after bariatric surgery is really very significant. It can be a huge, huge issue that results in a lot of depression, and I think it outlines some of the psychosocial things that we see after surgery. Those all often occur as a result of not being properly informed and educated about what's going to happen after the surgery. So let's see what kind of questions we've got. Okay, so Lisa Weiland, your set point smoothies have me at my healthiest ever. I love set point smoothies. So what is a set point smoothie? I have a video on YouTube. I'm in the process of putting together an updated video that really, I think, enhances the set point smoothie, because over 5 years, I've kind of learned how to make these things a lot better. But the classic set point smoothie is a green leafy vegetable like spinach or kale, and fruit, and then oftentimes some spice. Like I like green tea, and that gives you caffeine, which can help you replace coffee. Some other things that people put in there are cilantro or parsley. I like ginger a lot. I'm adding yogurt and nuts as well to them to add a little bit of protein and make them a little bit more of a meal. But that's, those set point smoothies I think are a great way for you to get a lot of vegetables in. And really it makes that kind of, that first meal of the day, that this automatic thing and something that when you're starting your day off on the right foot. So Mia Campbell, is there anything I can do to stop the weight loss? Hit 8 months post-op, down 165 pounds. I'm so skinny and have so much skin. My doc told me to eat more. So I need to know more about that, Mia, to really give you good advice. I will tell you that in very, very, very rare circumstances will I encourage a patient to eat more or to take efforts to gain weight or to slow the weight loss down. And I have a few patients out there who are super skinny after surgery. I'm talking like 5'8", 110 pounds, but they feel great. And when I check their nutritional labs are perfect. And they eat comfortably. They don't vomit or have any difficulty. So the thing I would say to you, Mia, is if your nutritional labs are okay and you're not seeing any major deficiencies, if your iron's a little low or things are a little bit off, that's somewhat normal at 8 months, especially after 165 pounds of weight loss. But if we see marked and dramatically low protein levels, and you're starting to have signs of systemic disease and not feeling well and have no energy and are totally run down, or when you eat, you throw up, or it hurts to eat, or you're not eating not because you don't want to eat, but because it's painful and uncomfortable, that's a problem, and that needs to be fully evaluated. And in that case, too much weight loss is very concerning, and malnutrition in a patient who's not doing well after bariatric surgery is potentially fatal. So if that's the case, if you feel awful and terrible and horrible, then absolutely a lot of steps need to be taken to fix that. However, if you feel good and you've done well, and what I find also is a lot of times if we look at your BMI, it's normal. A normal BMI for a woman is between 18 and 25. And I see patients and their BMI is 19 or 20. And there's a lot of people walking around out there who are the same age as you, the same height as you, and have the same BMI of 19 or 20, and nobody's telling them to gain weight. So why should we be telling bariatric surgery to patients to gain weight? So the reason I feel so passionately about this is because of what I talked about earlier, that inevitably weight gain is kind of the battle, and to take steps to try to help yourself gain weight when we look way down the road 5-10 years from now, where weight gain is to some degree inevitable, and we've kind of so early on in the process gotten off track and started to try to almost force yourself back to some of these old habits that are not ideal and are setting you up for long-term weight loss failure, to me is dangerous. So again, I need more information, Mia, but those are my thoughts on someone who's lost too much weight. Okay. So Lisa, looks like your husband had the sleeve, but you like the set points. So Mark Brass, great question. Your thoughts on Saxenda? I had a sleeve and gained some weight back. Specialists and internists are considering Saxenda. Pros and cons. So, all right. So Mark, that's a great question. So first of all, what is Saxenda? Saxenda is the newest weight loss drug that's out there. It's actually the same thing as Victoza, which is a diabetes medicine, and it stimulates one of the pathways that is also stimulated by bariatric surgery. It's an injectable, and it's about $1,000 a month. Some insurances will cover it. It is a huge pain in the butt to get covered, and often with most patients having $5,000 and $6,000 or even higher deductibles, a lot of this is going to come out of your pocket. So the first issue with Saxenda is the cost. So when I look at patients who've regained weight, I have a very systematic way that I look at things. And I actually, if you look on my website, poundofcureweightloss.com, if you go to course number 1, I have one of the topics there is what causes your set point to go up. And there's about 8 or 9 different items, and each one has a video where I kind of go over items that cause your set point to go up. When I see a patient in the office who's gaining weight after weight loss surgery, first thing I do is I look at that list and I go through that list with that patient. Have you started on medications that have caused weight gain? Have you returned to eating processed food? Has there been a period of inactivity or injury? What's your sleep cycle like? Are you having excess stress and depression that may be triggering this? And again, if you go on that course number 1, nutrition course number 1 on the poundofcureweightloss.com website, it will go over this in great detail. I think anyone who's regaining weight, that's where I would have them start, is looking at all of those items and really doing a deep dive into their lifestyle to make sure there's nothing there that is triggering weight gain. And then the next item in that course is how do I lower my set point? And there are 4 ways to lower your set point. This is a long answer for should I be on Saxenda, but it's nutrition, exercise, medications, and surgery. So you already had a sleeve, so the surgery part is out. So when I look at a patient who's regained weight, I go through those. Are we maxing out nutrition? Mark, are you on the metabolic reset diet, which is course number 2 on the Pound of Cure Weight Loss site? Are you following it thoroughly or as close to it as you possibly can? Or are you eating processed food? Are you kind of back to your old habits in terms of, say, fast food or lots of breads and rice and potatoes or junk food or sweets? If you're on those, if you're eating those types of foods again, then before I'd start you on Saxenda, I would work on that. Fix the diet. The next thing is exercise. And course number 4 on poundofcureweightloss.com is about exercise. And some people are capable of really high intensity exercise, which can drive additional weight loss. Other people are not. They've had hip or knee replacements or have other injuries or have other time or financial issues that limit their ability to exercise. And if that's the case, okay, but we should at least fully explore that. And then the third item is medications. Now, Saxenda is probably the best weight loss medication out there. But the question that I would ask is, can you take this for the rest of your life? You can safely medically, but can you afford it? Will you continue to have coverage with it? And do you want to take it injectable? I think Saxenda is once a week. I'm not certain about that. But you're going to have to inject yourself once a week. Some of them are once a day. If anybody knows what Saxenda is, if it's once a week or once a day, I don't prescribe it much because I can't get it approved and it's too expensive for 98% of my patients. But it is an injection that you have to give yourself very regularly, and you're committing to that really for life, because what would happen if you stopped taking that medication? We'd see weight regain. So my thoughts on Saxenda are great, but is it the long-term solution? It can be very helpful, and I'm not disagreeing. I think it may be a useful tool for you, but I would really fully explore nutrition and exercise before I went there. Let's see what else we've got. Nicole Cooper, you did my surgery about 9 years ago. Hello, Nicole. I lost close to 200 pounds. I do remember you, Nicole, by the way. 9 years later, I've only gained about 30 pounds back. I'm still happy. Well, that is very good to hear. And I think that really raises a point I made earlier, which is that almost everybody will regain a little bit of weight. And I think, if we look at Nicole's, and again, I'm not saying this from memory, and I'm using you, Nicole, as a general case, not as a specific HIPAA, releasing any type of HIPAA compliant information. But if we say, look at a bariatric patient before surgery, they are often gaining weight before surgery, and then they have their weight loss surgery, and we can potentially get back on that path. So Nicole, I think, yes, regaining 30 pounds over 9 years is still doing pretty good, but I would really work with you to stabilize that. I'm happy to see you in the office, and we can kind of get you on the right track. By the way, if you come to my office, I give you a free 6-month subscription to the website, so you don't have to pay for it. That'll more than cover your copay. So if you want to come back in, Nicole, I'd be happy to kind of talk to you about how we can get you on track so that you don't regain any additional weight. And I'd love to see of all the patients who I look forward to seeing in the office, it's someone who I've operated on 10 years ago that I look forward to the most. That to me, especially someone like Nicole, who's doing fantastic all these years later, it's really great to see, and it gives me a lot of confidence too that what we're doing here with weight loss surgery is the right thing. So I got a thank you from Patricia. You're welcome. I think that's a high five. Mark, back to Mark Brass on Saxena. Lisa Weiland makes green tea ice cubes. So Lisa, that's awesome. And I think what this is what I call a pound of cure hack. And people look at following a good diet as something that requires willpower and discipline. I don't look at it the same way. I think it's something that requires strategy, experience, and practice. And if that's the amazing thing about Facebook and about our, not only our Pound of Cure Facebook page, but there's so many other pages that just have great ideas out there. There's so many clever people who've thought of a better way of eating, of doing something that's easy. How hard is it to make green tea ice cubes? It's really not hard, but it can make a drink delicious. There's a million ways you can use it. And so little things like this, whether it's a cooking gadget, I love the Instapot. I love the cutting gadgets. To think that chopping vegetables has to be a chore is wrong. It can actually be a lot of fun. And you've got these chopping things, and you can do it really quickly, and you can make delicious salsas and other things like that. And to me, eating a great diet is about figuring out a strategy for doing it, rather than having the discipline to stick to it and to turn down all the unhealthy foods. Once you get into the positive side of this and looking at all the really great foods that you can eat and embracing the healthy foods, then all of a sudden saying no to the bad foods isn't quite so hard. And all these clever hacks are so helpful for kind of getting you over the hump, not to the point where you're missing all the processed foods, but where you're enjoying this new healthier diet. So love that idea, and that's a total Pound of Cure hack. So from Connie Wish, if you regain, what do you do to lose it? So I think another thing is when you're posting comments also, if you want to tell me what surgery you had and when you had it, and how much weight you've regained, sometimes that can be a little bit more helpful. So again, Connie, I think I would answer that question, getting back to that first course on the website, where I would first look at all of the different causes of what I call your set point elevation or weight regain. So looking at medications, periods of inactivity and injury, stress and depression, dysregulated sleep-wake cycles. Are you working the midnight shift? Processed foods. Have you started drinking sugar-sweetened beverages? And identifying any issues there that have caused the weight gain. And then starting with nutrition, going to exercise, and then looking at medications. And then also, depending, if you've had a sleep, then a revision surgery is also on the table, but only after you've really fully explored everything else. All right, we've got a question from Jamie Barnes Farrell. Is the gastric sleeve still a risk for patients with GERD, or have there been new studies, new information? So that's a great question. And I love the sleeve because patients practically hop up off of the operating room table and say, thank you very much, can I go home? And can be back at work within a week or so. The transition, through that first month. That recovery phase of surgery tends to be easier for sleeve patients. And what I also love about the sleeve is we see so few long-term complications. With the bypass, we can see ulcers, we can see bowel obstructions, we can see alcoholism, which is a complication of the surgery without question. We can see iron deficiency. We can see complicated gallstone issues. With the sleeve, we see one thing and one thing only, and that's heartburn. And the problem with the heartburn in the sleeve is that it's variable. We have some people who have heartburn and they're getting better. We have other people who have debilitating, life-altering heartburn after sleep. Thankfully, it's a small group, but it's probably somewhere between 2 to 4% of all sleep patients, which is a lot of people when you figure out how many surgeries we're doing, how many sleeve surgeries we're doing. So for most patients who have a sleeve, I'd say about 25% have worsening heartburn. So if you have bad heartburn, can you have a sleeve? I think that's a little bit of a tricky question. The way I approach that with patients is that I work on improving their heartburn through other means. If they're smoking, obviously that has to go before surgery, and smoking can really contribute to heartburn. What I find so often is that patients can get on that metabolic reset diet. That's course number 2 on the poundofcureweightloss.com website. They get on that diet and their heartburn all but goes away. So they have kind of, what I call like TV commercial heartburn, which is you eat a cheeseburger and then you have a heartburn. That's really not heartburn. That's the negative side effects of eating a cheeseburger. So when we look at that, people will eat cheeseburgers from time to time, but that doesn't mean they have a medical disease that needs to be treated with medication. It means they need to try to limit their cheeseburger intake. So when I look at kind of TV commercial heartburn that gets better with a good diet, then we can, then those patients I would be happy to offer a sleeve to. We also have this hiatal hernia component where the stomach is pooching up into the chest a little bit. And when that happens, we repair that at the time of surgery. So we're kind of doing something to help the heartburn. At the same time, we're doing a surgery that may worsen heartburn, and that tends to be a little bit of a wash. So I think, Jamie, it's a long and complicated discussion. And I actually, if you look at the course number 1 for bariatric surgery, I think I have like a 20-minute video about heartburn and the sleeve. So I put out a lot more information about it, but it really is a complicated problem and one to discuss with your surgeon. But the truth is there hasn't been a lot of changes. We're working on some stuff. I'm actually part of a research study where we videotape everybody doing the sleeve. And we try to kind of break it down, and there's little technical differences from surgeon to surgeon. And we're trying to look, because there is also variation from surgeon to surgeon. There's not a huge amount of variation in terms of weight loss. So a sleeve by, the guy on the west side of town versus a sleeve by the guy on the east side of town, we don't see a lot of difference in weight loss. But we can see difference in heartburn after GERD, where we have some surgeons where their patients, 50, 75% rate of heartburn, and other surgeons who have like a 10 or 15% rate of heartburn. And we're trying to figure out why that is. We're moving along with the research. We don't know yet. We haven't figured anything out. There's no smoking gun. These sleeve surgeries are very subtle. It's a few millimeters can make a difference in terms of how people do afterward. So again, more on the website. So Mia Campbell, 5'10", 150, not sick. Labs are great, just had them done. I think, Mia, were you the one who everybody says you're losing too much weight? Is that you, Mia? Yeah, okay, so you're 5'10", 150. I don't have a BMI calculator in front of me, but I would put your BMI, I would guess, at like 23-ish. I don't know. Yeah, 21-ish, somewhere in that range. I would definitely put your BMI in the normal range. I'm sure it's not 16 or 17. And you're still 150 pounds. There are a lot of 5'10" women walking around who are 130 or 140 pounds who are much lighter than you, and no one is telling them to gain weight. Your labs are great. You're not sick. You've just had them done. I'm assuming you're feeling well. I would personally don't try to gain weight back. That will happen on its own. And that's another thing I really like about this kind of veggie first approach is that, so you should eat lots of vegetables. You should eat lots of fruit, nuts, seeds, and beans, just like everybody else. you're going to get plenty of nutrition, and that's a really healthy diet. Are you eating for weight loss? No, you're eating for health, and health that just so happens to also drive weight loss. So I think that's what I would recommend. You really stick to the Pound to Cure diet, which if you look at it, it also resembles a very healthy diet. So people of normal weight can eat the Pound to Cure way and do well. People of normal weight, I think, should not be like cutting carbs or doing very low calorie diets or taking other kind of more extreme measures to lose weight. I think and that's really the difference between a diet driven to cause weight loss, which is almost always temporary, versus a diet where the main goal is to drive health, which tends to be fairly permanent. So yeah, so Mia, I would say you're doing great, and I would not try to gain weight. So Mark, the weight gain was 40 pounds. He was 170. So it looks like you've gained 210. I don't know where you started, but it looks like you haven't gained all your weight back. I think, Mark, I would, if your nutrition and your exercise is there, then I think Saxena is reasonable. But again, it sounds like you're being well cared for. So Mia Campbell, how much 8 months out is normal? Third cup to half cup I eat. I feel great now. Energy is coming up now. Will my body stop when it's ready to then? Sorry for so many questions. Military docs aren't the best. No problem with the questions. That's why I'm here, Mia. So how much is the right amount to eat? Well, first of all, it depends on what you're eating. You could probably eat plenty of yogurt or cottage cheese or applesauce, but very little chicken or fish. So the amount of food that you eat is dependent on the type of food that you eat. The second thing is it's different for you than the next person. And you're at 8 months, it might be different at 10 months, and it's definitely different than it was at 6 months. And people kind of recover from the surgery and have different appetites and different capacities, and to set hard and fast rules about how much you should be eating is not right. Instead, I focus on, and this is going to be a big set part of what I discuss in the recovery phase, because I think in that recovery phase, you want to learn mindful eating strategies. Mindful eating means you take a bite and you chew it and you think about the food and you taste the food and you focus on the food. You're not also reading the paper. You're not, watching TV. You're focusing on your eating. You're focusing on every bite. Every bite is a conscious decision, and you're seeing how it makes you feel. And in that immediate post-operative phase, when one too many bites could make you throw up, man, you better pay attention. But you can learn that and carry that through. And Mia, I would encourage you to eat that way. And when you start to feel full, you start to notice that, it seems like it's enough and I could stop eating, then you stop eating and kind of learn that, rather than say, okay, I should eat this much food and I'm going to eat this much food. It's a third of a cup. I'm putting it on my plate. That's what I'm going to eat. Instead, I would say, I'm going to stop eating when I start to feel these symptoms. All right. Dena, I'm going to butcher this last name. Barry. I had the sleeve 2.5 years ago, gained 10 to 12 pounds after the death in the family. One of the causes of set point elevation, stress and depression. That's a good example of it. Unfortunately, I'm sorry for your loss. I need some help. I'm exhausted all the time. So Dena, number one, get your iron checked. If you're exhausted all the time, 2.5 years, you've had a sleeve, you need to make sure your iron is appropriate. And if it is low, take a bariatric or chelated iron supplement. Do not just go to the drugstore and get ferrous sulfate, which is the usual iron supplement that most people take. Most other doctors don't recognize that there's an important difference for bariatric surgery patients. This is especially true of the bypass, but also true of the sleeve. And the second thing I would look at is your nutrition. And then if you think it's appropriate, talking to a counselor and making sure that your exhaustion is not actually depression, which is very common. We just put some evidence from put together some evidence from our data collaborative. And that's going to be a topic in the end of the honeymoon years. A big component of the end of the honeymoon is that, is depression. And we do see at about 2 or 3 years out that the depression levels of patients who've had bariatric surgery tend to be higher than those who have not. So in that first year or so, that honeymoon period, actually depression levels go way down. And it's that end of the honeymoon period where we start to see stress and depression. You know, you throw the death of a loved one in, you throw a little bit of weight regain in, you're 2.5 years out from a sleep, you're at the end of the honeymoon period. So I think, you know, that's something that I would fully explore and get some help, either in a support group or from a psychologist, your primary care doctor, or somebody. That would be my thoughts on that, Dena. And, you know, how to address the 10 to 12 pounds of weight loss. I'm kind of a broken record when it comes to that. Get yourself on the metabolic reset diet. That's course number 2, which is fruit, vegetables, nuts, seeds, beans, a little bit of animal protein, getting the junk and the artificial sweeteners and the refined sugar and the breads and the grains out of your diet. And that'll also really help a lot with the energy level. So Patrice lost 20 pounds on Saxena, and then that was it. That sounds about right. Saxena is probably the most effective weight loss medication out there. 20 pounds is pretty good. Another medication that I haven't used for the same reason I haven't used Saxena, which is the cost, is Farxiga, which is a weight loss, which is a diabetes medicine as well. But you can really lose a decent amount of weight on it too. It's not approved for weight loss, but, you know, we can write it whatever medication we want. We're not limited by FDA approval. That really just determines what they can advertise and market for. Farxiga is about half the cost, and it also works in a different way than the Saxena. You know, if you want to start really getting on a lot of medications, there's other medications that can be used. But Saxena is 20 pounds is pretty good for medication, to be honest with you. So Patrice does have insurance coverage. Good. All right, we've got some hellos. What other weight loss medications are used with regain after the sleeve? So I do have again, I hate to kind of sound like a broken record, but there's a video on weight loss medications going over all of them in great detail. But to summarize, phentermine or Adipex, metformin, and then something called Contrave, which I typically use the generics, which are Wellbutrin, and a drug called naltrexone. And they kind of each have a little bit of a different profile. I talked about Farxiga and then also Saxena. And again, there's a video that really goes into detail with the side effects and the pros and the cons and what to expect. The bottom line with medications, though, is they help a little bit, but they're not going to solve this problem. This problem is going to be solved through nutrition and exercise. They can get you over the hump. What can I do for those last 10 or 20 pounds? It's medications. What can I do for 50 or 60 pounds? It's not medications. Kelly Sanders. Hello, Dr. Weiner. I'm 5.5 years post-surgery. I've seen you in the Commerce Clinic. I've kept 160 pounds of the 170 I lost. So good to see you, Kelly. Glad you're on Facebook, and congrats. You've lost 170 pounds, only regained 10, 5.5 years out. That's amazing. I would love to see you. I'm now in West Bloomfield. It's not that far from Commerce. Love to see you again and see how well you're doing. It sounds like this surgery is working great for you. But even at 5.5 years, we can start to see you get on that 5 or 10 pound a year track. And I think it's important oftentimes to just come in for a tune-up, and we can kind of say, you're doing this one thing. Did you know how much risk that puts you at for weight regain? I never thought about it. I never thought about that. That creamer I'm putting in my coffee, really, that's that big of a deal? It can be that big of a deal. It can cause those 5 pounds a year weight gain. So sometimes we can kind of work through those and just make sure you're on the right track and you're not doing something unknowingly. So many times I have patients come into my office who've regained some weight, and when we kind of dig in and figure out what this is, and we piece when did it start, what caused it, what was happening in your life, and we kind of dig in and problem solve, it's so many times the patients are like, I had no idea that was causing weight gain. All right, so we're actually 9 minutes past how long I had originally intended to do it. Got a few more questions. I'll try to get a few more in. Patty Lynch, I had the Roux-en-Y open surgery back in 2003. That's an oldie right there. You're 15 years out, open surgery. You only lost about 40 pounds with it. Was 289, did the HMR diet, lost more. Now I've had the Rose Apollo procedure, but there is no support anywhere. So I don't even know what the Rose Apollo procedure is unless you're talking about the gastric balloon. Here's what I find, Patty, is when patients come to me, first of all, losing 40 pounds after gastric bypass, starting at 289, that's unusual. You should have lost more. That's way outside of what I would expect. When I see patients who've had their surgery a long time ago, I make sure I get op notes or do x-rays or CAT scans or endoscopies or whatever I need to know to do to figure out what surgery you really had. Because so many times back then, before bariatric surgery was kind of more standardized, there was a lot of kind of freelancing out there where people were almost making up surgeries. And a lot of times I've seen, I can't tell you the number of times patients have told me, for 15 years, they told me they had a gastric bypass, and then I found the operative note, and they didn't have a gastric bypass. They had a vertical banded gastroplasty, which is a totally inferior surgery, which can be revised, and there's a lot of opportunity for. Or they had a duodenal switch, and they're much more subject to vitamin deficiencies than I think. So what I would say to you, Patty, is figure out what surgery you really had. Get in touch with a weight loss surgeon. If you're anywhere near Detroit, I'd be happy to see you. But get the operative notes if you can, and any recent CAT scans or imaging studies that you've had, so that we can make sure that you really did have a gastric bypass. Another Patty, 9 years post lap band with another surgeon. Have a new patient appointment with you next week to address a 50-pound gain and how to move forward with a pound of cure. I will have a lot to say about the lap band. Too much for this Facebook Live, but certainly that's going to be a topic for another session. And I'll talk to you personally about that. But I do have a video about the gastric band on course number 1 in the bariatric section that talks about how to, why we don't really do the band anymore and what our options are if you've had a band. And I'm going to put together a lot more videos. So Sherry had a lap and a 7-year converted to a bypass. Too much scar tissue. Lap band is awful long term. I wouldn't disagree with that, Sherry. Dawn Ryder, my prealbumin blood work came back low. How can I increase it? All right, I'm going to make this the last question. And I'll just briefly discuss prealbumin. So I use prealbumin, actually, there's a really important way that I use prealbumin from a nutritional perspective. Prealbumin is our most accurate measure of protein. We have another blood test called albumin. Albumin tells us our protein status over 3 or 4 months or longer, and it can kind of shift around a little bit from some other conditions. Prealbumin gives us a shorter term evaluation of your protein level. So it really is just a measurement of protein. Are you getting enough protein? So assuming, most patients with a low prealbumin have had a gastric bypass. Sleeves, we don't see nearly as much low prealbumin, but it basically means you have low protein. At 3 or 4 months after gastric bypass, pretty much every patient has low protein. I'd say about a quarter of sleeve patients will have a low prealbumin. Somewhere at 6, 9, 12 months, the prealbumin kind of clicks into the normal range and then goes on to be normal. This is common and not cause for concern if you're in that first year. If you're further out, it's a little more concerning, and I'd really want to dig into your diet and your health and see if there's anything else going on. I use prealbumin as a measurement for when you should switch off of protein shakes. So we use protein shakes to supplement our nutrition, and I look once the prealbumin normalizes. That's when I switch over, when I basically tell patients, all right, you're not protein malnourished anymore, so we don't need to take in extra protein, because protein shakes are processed. They're an animal protein. They're artificially sweetened and they're artificially flavored. So they pretty much fail on 4 levels in terms of it being a healthy food choice. Instead, the set point smoothies, which we talked about earlier, can be used, which are not processed, don't have artificial flavors, don't have artificial sweeteners, and typically don't have animal protein. We can argue about yogurt and animal protein. I think I kind of consider yogurt sitting somewhere between vegetable protein and animal protein in terms of its impact on your health. So let's make that the last question. I really appreciate everybody coming on. I'm going to do more of these. It's a lot of fun for me. I think we got the technology down a lot better this time, and my arm's not as sore from holding my phone, and I could see the questions much better. And I look forward to this. We'll have another one in a couple more weeks. If in the meantime you want more information, my new website, poundofcureweightloss.com, has tons of information for anyone kind of looking for that structured information that kind of helps you really understand what's happening to your body after weight loss surgery and what the ideal nutritional plan looks like for a post-bariatric patient, or really anyone who wants to be healthier and lose weight. Thanks.